at the beautiful Queanbeyan train station at the moment, and tonight it's the meeting of the National Conference. They're waiting to board the heritage listed train for a lovely night to meet and greet, I believe. And we're here tonight to represent nurses from all across New South Wales, and we're fighting for safe patient ratios, particularly in country hospitals and in areas that don't already have mandated ratios like ED, ICU and paediatrics. Basically, we're here to make sure that the people of New South Wales stay safe while in hospital. Today to support patient ratios in country hospitals. As you know, it's a big problem. We had a relatively good response. Lots have been quite generous with their time and spoken to us, but sadly quite a few haven't as well. There's a lot of education that needs to be given, I think.
Everybody's doing a brand new dance now. Come on, baby, do the locomotion. I know you get to like it if you give it a chance now. Come on, baby, do the locomotion. My little baby says I can do everything.
This is our job. We take pride in our work. We take pride in caring for people. And if we can't do that properly, it impacts us. It impacts us at work, it impacts us at home, and it impacts us in the community.
I mean, we have to make our presence known and remind the National Party delegates of what it is that's important in the community. Safe patient care needs to be explained in terms of what it means, and that means we need more nurses. It's as simple as that.
Ratios will improve patient care, will decrease patient death and increase nurse happiness, which will keep nurses in the workforce.
And I'm speaking as a new grad, so I'm brand new to the profession, and yet I'm here today because I believe in supporting our profession and supporting our patients, because without us standing up today, in 20 years' time when I'm still in the profession trying to fight my way to the top, we're going to be looking at these problems exacerbated by 1,000-fold.
We want to provide a better health service for our community, and there's nothing worse than walking through your local supermarket and people say, well, you didn't care for me properly, and that's all, you break your back to try and do it.
We're always fighting just to stay afloat, rather than fighting for the incredibly high care that we should be giving.
We have to chip away and we have to make our message heard, because we're advocates for patients, and it's in our job description to fight for safer patient care for our patients.
At Orange Bay Hospital itself, in order to actually get to the appropriate levels of staffing, we need another 12.5 nurses. He has over 1,000 nurses just in his constituency alone. Now, if you thought about the number of patients as well in the entire area, I think he'd be quite astonished to see just what we're actually caring for and coping with in that region.
We would like to see that he would come forward and say, righto, I'm going to help you. I'm going to put it forth down in Parliament and make sure that your voice is heard.
Thank you. I'll take that back to the House, and we look forward to the debate in coming months.
He said that he was fully aware of the situation and that he was working towards safer patient care. We're supposed to be a rich, developed country. Well, take a look at people's health in the bush. Leaves a lot to be desired.
We spoke to Warren Truss briefly earlier on today, and he's from Maryborough, he's from a country town with a small hospital, and he didn't realise that the nurse-to-patient ratios were different in country hospitals than they are in city hospitals. And once we outlined that, he was quite surprised and actually sort of said, we need to fight for this, we agree, he agrees.
We're here in rainy Queanbeyan, walking around some of the streets and door knocking and trying to meet some of the locals to talk to them about the issues, particularly about ratios, and trying to get their support with supporting the campaign for ratios in the country as well as in the city. We want to raise awareness with the National Party for to hope they'll stand up for country patients as well as city patients.
We just went to one house and the person that came was a Jehovah's Witness, and she turned it around to say that she was teaching us that God will come down and get rid of this government, and then things will be fixed.
We've already seen bed cuts, we've already seen wards closed, we've already seen positions cut and lost, and I think they're at real risk of getting worse. We're looking at a federal budget that's transitioning into a state budget, and there are real risks that we're going to be losing nursing hours. We're in the profession because we care about people. We want to give good, compassionate care, and we want to do it safely.